Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. Industry experts say CMS appears to have implemented changes without notice to the new hybrid antipsychotic measure that was set for the third quarter of 2025. Instead, providers are seeing recalculated 5-star results appearing to apply the new methodology, despite no communication. Many saw a drop in total points, and some may not even realize it happened. The impact could be significant, especially in states like Ohio, where quality incentive program payments are tied directly to CMS metrics. With point values shifting, prior projections may no longer hold, and those effects could become more pronounced when QIP values are recalculated in July of 2026. At the center of the change's expanded data use, CMS has updated the long-stay antipsychotic measure to include Medicare and Medicaid claims and Medicare Advantage encounter data, in addition to MDS data. As a result, the national average jumped from about 14% to nearly 17%, pushing many providers into higher percentage brackets. Because star ratings are calculated using decile-based cut points, even small shifts can mean losing a star, a change affecting reputation, referrals, and reimbursement. Experts say the bottom line is awareness. Providers need to review their revised data now, understand new specifications, and be prepared to explain rating changes driven by methodology, not care delivery. The Department of Health and Human Services, OIG, is actively reviewing how medical directors are used in SNFs, including the hours reported, whether they can realistically fulfill expanding duties, and how engagements are monitored. Are MDs genuinely involved in resident care, quality oversight, and policy implementation, or whether some arrangements exist largely on paper? Concerns have been raised about how facilities report medical director hours through the PBJ system and whether data reflects meaningful involvement. The OIG and DOJ have aggressively pursued cases involving sham MD arrangements, including contracts with little documentation of actual work, flat monthly fees that don't align with services provided, agreements tied to referrals, or even to disguise kickbacks. Surveyors are now focused on whether MDs actively direct and monitor care, particularly in high-risk areas such as antipsychotic use. Facilities must be able to show the MD's involvement in developing, approving, and enforcing care policies, and in intervening when prescribing practices fall outside of professional standards. Surveyors are expected to interview medical directors and staff, review QAPI involvement, and look for clear evidence of oversight. As scrutiny increases, providers may find that proving the work was done is nearly as important as doing the work itself. Attorneys general in 18 states are pushing back on CMS's decision to repeal the federal nursing home staffing mandate, urging the agency to replace it with a rule aimed squarely at for-profit operators. In their filing, the AGs accepted the repeal, but warned that eliminating staffing standards altogether would leave residents vulnerable and asked CMS to adopt a new minimum nurse staffing requirement. The proposal would apply the long-debated 3.48 hours per resident per day standard only to for-profit nursing homes with related party real estate management, staffing, therapy, or financing arrangement, as well as those owned by private equity. State officials argued those structures create incentives for chronic understaffing and self-dealing. California Attorney General Bonta said his office frequently investigates cases involving severe injuries and neglect at for-profit homes, warning repealing the rule could invite further private equity expansion without stronger oversight. Consumer groups, including AARP, echoed concerns, pointing to data showing nonprofit homes are far more likely to already meet staffing benchmarks. Provider groups countered that targeted mandates worsen staffing shortages and limit access to care, especially in rural and underserved areas. Industry leaders thanked CMS for repealing what they called an unworkable rule, while urging the agency to focus instead on workforce development and reimbursement reform. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.